I like to do pictures, and I just want to say that 1 in 3 people right now in this country know they need a medical procedure, and they are putting it off. And these are not people that don't have insurance. These are people that have insurance. What's happened is our deductibles have gotten so high, we can't afford to use that insurance. It keeps growing, but it's around 30% of the population now. So, and then I'll click. Okay, so what's going on? Why can't they afford it? What's happening to the price of all these procedures and these medical expenses? And so if you look at 2017, we spent $3.2 trillion on healthcare. And I'm glad there's a bunch of doctors in here. Hopefully you guys have the answer. So I'd like to put a little question up here. What percentage of that 3.2 trillion do you think was caused by the doctors, right? It must be like 70%, 50%, right? Yeah, what portion is doctor pay? What can we work on?
It's about 8%.
This man wins the prize. It is 4%. 4%. So you could make the doctors work for free, and it's not going to move the needle, right? So what's going on there? And when you look at it, it's really all these administrative middle layers. You know, medical coding, billing, collections, adjudication, which isn't up there, which you guys know, it's the pretext before you send the bill in to make sure it's right. So these costs make up anywhere from 30 to 60%, depending on who's measuring what and what you're counting in there. Now, let's look at an actual example. Normally, I don't put this many numbers on a slide, but this is a great case. It's a specific case that actually happened. Somebody needed what I always call an upper and lower colonoscopy, but the gastro guys keep telling me, no, that's an EGD and a colonoscopy. But anyway, so with insurance, it's $16,000, and the patient doesn't care what it costs. They only care what it's going to cost them. And their deductible was $5,000. So when you run that through and you look at what the doctor's going to receive and all the expenses, all the costs and everything, and then you look, okay, well, what if he looked at Healora? And this was a guy that was looking at Healora. He was actually looking at us as an investment. And he said, well, let me just see what it costs to do this colonoscopy. And he looked it up and he said, wait a second, $3,500 total, all in? Can that be right? And the answer is yes, it can, because when you cut out, all of these items, you can save a lot of money. And in fact, the doctor with Healora, the physicians we target generally Medicare plus 20, and they're paid in cash the day of service. Whereas with the other side, either insurance or Medicare or whatever they're doing, it's 90 to 120 days, you're fighting all the way, paper back and forth, and you're lucky if you get paid, right? So anyway, that's kind of the way it looks. And remember, the doctors get paid their full fees. We deal with a lot of doctors, and I was just talking with somebody here a minute ago, and they were saying, what if they have a lucrative contract, which are out-of-network contracts, right? You're getting paid 300, 400, 500% of Medicare. But that's becoming a smaller and smaller amount of the pie because the insurance companies are starting to say, wait a second, we know you guys are tweaking the system to get those out-of-network lucrative contracts. So that's getting more and more narrow. It's really important to have a primary care doctor. And it's funny how the primary care doctors are coming back and to be very, very important in this process. Very important in terms of outcome, very important in terms of getting the write-up right. When that patient gets sent to the specialist needs to know, kind of like the old days, where the primary doctor would write up what's wrong with them, give a background, do a full workup, and send him over to the specialist. And now that doesn't happen. That 7 minutes is all that primary care guy gets on average with a patient these days. They're seeing 50, 60 a day. But we have direct primary care doctors who have maybe 900 lives, and they're seeing like 5, 6 patients a day, spending a lot of time. They're actually really loving what they're doing, and they're making far more money than they ever made before. It's a win-win for everybody, and the patients especially, because they get to see their doctor, and the doctor gets to actually go through all the pieces with him. Let's see what else I've got. Oh, this is our team. So you know about me. I've owned and exited a couple businesses. I have kind of a financial sales background, MBA at USC, which costs way too much money. Our CTO is Parshant Jain. He's unbelievable. He should actually be here because he founded recently an AI company called Simplify Reality, by the way. And he's helping us get customer service aligned properly because customers don't want to talk to anybody anymore. They want to call in or type in. They want to get to their information and get it done. And that's difficult to do in this space. But we're going to work on it, and over the next couple of years, we're going to get it done. My co-founder is Dr. Julian Henley. He's a double board certified surgeon. He was on Yale clinical staff. He studied engineering at MIT and physics and mathematics at Harvard, and he actually did a healthcare startup and exited back in 2012. It was called PriceDoc. But so he and I are the ones, sort of a patient and a doctor, trying to help doctors and patients change this crazy healthcare mess.